Just recently, quite a few people have asked me what the difference is between the approach of Labour councillors and Conservative councillors. There are people who think that we all ought to be able to get on with each other, that we all ought to be able to find common ground on every issue. I find myself sometimes asking why we have a county council. County council provides fire service, transport, social workers, it provides care for elderly, vulnerable people. It provides services which people can't easily provide for themselves. It is a way that we can all get together, either through paying council tax or indeed through working in the county council or working with organisations that work for the county council, in order to help people in a way that we wouldn't be able to do for ourselves. Now, the fact is, most people do most things for themselves, and certainly in social care that is the case. Most elderly, vulnerable people are looked after by their relatives most of the time. And we couldn't possibly afford to change that, nor would we want to. I think if you're in a position to be able to help a relative, whether that's a young person with learning difficulties or severe disabilities, or an elder relative, then that is the best form of help that they can get. But there are always going to be people who need that extra help, and they need that help from the county council. And when people require that help and buy that help, they need to know that they're going to be safe. So in home care, in residential care, people want the most appropriate level of help. If they can help themselves, they will, but if they need the help from the county council, they need to know that that care is going to be delivered to them in a safe way. They need to know that they're going to get the care that they are actually in need of. Now, on average, in this region, it costs about £31,000 a year to put somebody up in a residential care home. Suffolk County Council, for the people that it places in residential care, pays on average £24,000 a year. That's a £6,000 a year shortfall. And as a result of that, the providers of residential care for the county council in this county are not able to easily afford to do the job as well as they want to do. Now, I'm not having a go at every provider of social care in this county. A lot of people working in social care in the private sector do a fantastic job. The people working on the front line work extremely hard under very difficult conditions for very little money. But that is the whole point, for very little money, and in many cases for less money than they can afford to do the job as well as they would like to do it. Why would you pay more for something than you have to? Well, the answer is, of course, to get a better service. People pay often for things, far more than they have to, because they know that if they pay more, they get the service that they actually need, and not something which is not fit for purpose. And at the moment, the county council is placing people in care homes which have been rated as in need of improvement or indeed inadequate. In some cases, placing people into care homes which are likely to close in the near future. And that is just wrong. We also have some private sector providers who have done the sums, who've struggled through, and who have come to the conclusion that there is no longer any future for them in providing residential care. I don't think we've got any major providers who have come to that conclusion yet in Suffolk, but I wouldn't be at all surprised if they don't do so in the very near future. We have a crisis on the horizon, because if you don't pay enough for a service, sooner or later people will stop providing it. I don't believe that Suffolk residents will accept a situation where, if in extremis they realise that they are going to have to rely on the support of the county council for care, that care will not be adequate. I think when people have come to the point where they need the care from the county council, they expect it to be safe, secure, the best care that is reasonable to expect. And so we believe very strongly that while we all understand that there is not limitless amounts of money and that not everybody can have all the help that they might want, once the county council has decided that somebody needs the care enough, once they've decided the care package for them, once that has been accepted, that it will be safe, it will be adequate, it will be relevant and the best sensible package for the person who is getting it. Which is why we are bringing a motion to the County Council on Thursday demanding that this council stops putting people into inadequate care homes, that it pays the providers enough to do the job properly, and that encourages and enables the staff working in those care homes to get all the training that they need to do the job as well as they would like to do it. This is not a blame game. This is a situation where we all have a vested interest in knowing that we're going to be safe, in knowing that our loved ones are going to be safe, and in making sure that when people are doing the work that is needed in order to keep us safe, they are paid enough to do the job properly.